The Dr. Taz Show, the podcast. Dr. Taz, Superwoman Wellness. Here's Dr. Taz.
Welcome back, everyone. Welcome back to Superwoman Wellness, where on every episode of the show, I am determined to bring you back to your superpowered self. Joining me today, now this is going to be a treat, I have Katie Beecher. Katie Beecher is a medical and spiritual intuitive, but she's also a licensed professional counselor with over 30 years of experience. She has a very unique way of working with clients, creating really detailed, very accurate 4-page physical, emotional, and spiritual reports with symbolic painting before even ever seeing them and talking with them using only their name and their age. She's currently writing a book about what she does as a medical intuitive, her own healing from an eating disorder, from Lyme disease, and other serious illnesses, and helping others heal using information from her guides and spirit and using Jungian psychology. Her book will be out in 2021, which is going to be a good year. It's going to be published by St. Martin's Press. Katie, welcome to the show.
Thank you very much.
So this is a colorful background, as some would describe it. So you have experience as a counselor, a professional counselor. How in the world did you get involved in medical intuition and readings? It sounds like you've had a health journey of your own. So talk to us a little bit about it.
Sure. So dysfunctional family, the whole 9 yards, like a lot of people who go into counseling, you know.
Yeah.
And when I was 16, I realized that I had a pretty severe eating disorder. I was bulimic, and I really was kind of at the end of my rope, was feeling pretty suicidal because I didn't want to live that way anymore. And I fully believe it was divine intervention that made me call our pediatrician. I didn't tell my parents. I didn't tell anyone. Wow. I was too ashamed, and I really didn't feel like my parents would be that helpful. So I called and told them what was going on. And that was 1983, when no one was really talking about eating disorders. So at first he said, yeah, I'm sure you'll be fine. And I knew enough to say, no, I won't be. And so he gave me the name of a Jungian counselor. Took me a couple months to get the courage up to call, but finally did, and worked really hard with her. And so I always knew that I had the ability to talk to dead people, and didn't know what those abilities were about. Was pretty frightened by them because I would pick up negative things a lot. But Jungian counseling, or Jungian psychology, it really is very open to psychic abilities and intuition and even astrology. And it just draws from so many different things that she helped me to understand my abilities and accept them and talk to my intuition. And so that sort of started me on the healing journey as far as, you know, spirituality, and became a counselor. Always worked really intuitively, even though I had a clinical background.
Nothing formal at that time, just more from your gut, or more just...
No, I mean, I went to school, got my master's, and did all the stuff that I was supposed to do. And I think I worked very eclectically, using a lot of different forms of counseling, whatever I felt would work depending on the person.
Right.
Worked with a lot of eating disordered clients and things. But I always, you know, the core was always listening to my gut. And so then about 10 years ago, my mom became paralyzed from a flu shot. And I learned a lot about toxins and all sorts of things I hadn't been exposed to. And it really changed my life. And when something like that happens to you, it changes who you are. And what I was doing, you know, I had to stop my life to take care of her. And what I was doing really wasn't fulfilling anymore. And so I started looking for something else, and accidentally went to a workshop by Mona Lisa Schultz, who's a pretty well-known medical intuitive, and discovered that I could do it.
Wow. I've always been in awe of you guys. Quite honestly, just how you're able, I have patients that come in and they've seen somebody like yourself, and just the accuracy and the guidance. I think it's such a gift that you can give people. So how do you use that? How do you use that skill? How did you put it into use for yourself? Because you've had a number of things, even past the eating disorder. It looks like you had Lyme disease and all this other stuff. So how did you use it for yourself? And then how do you use it for others, you know, moving forward?
Yeah. So I just get someone's name and age, do very extensive report, and then a symbolic painting. So I use nonverbal, things as well as words from my guides. And it's kind of like looking into myself also, looking at all the different root causes and things that contribute to wellness as well. It's not just sick people who come to me. Mm-hmm. It's people who have all different things or just want to know, more about their intuition. But I use all of that information working with them, and we look at every single thing going on in their life, their relationships, their obviously physical issues, but trauma and life purpose and their own psychic and empathic abilities, and take everything as a whole and then see how is that contributing to their issues. What can we do to tweak all of that for treatment, for wellness? I work with other professionals that I refer to, because there are medical intuitives who diagnose, but it's not only illegal, it's unethical. And so I will identify symptoms, but then I'll say, these are people I really trust that you can go
this
to.
Is where you need to go
to further, either confirm what I'm saying or get treatment or things like that. So it's really a whole person approach, and people come out of there with a plan moving forward.
That's amazing. I think anything we can do to educate people, bring them to empowerment is helpful. How does it work for the folks out there who are like, what's going on here? I don't know about all this stuff. Maybe give us an example. If you were going to read, I know you don't know that much about me, but if you were going to read me, for example, like, would you just be reading for medical issues? Would you be reading for emotional issues? Would you be reading into life mission, life purpose, like those type of things? All of it.
It's literally complete. It's the chart that I have made based on Mona Lisa Schultz's stuff. It's medical, physical, spiritual. It goes into everything from, like I said, trauma, childhood, relationships, how those are functioning, whether you're expressing yourself or not, your creativity, your, like physical stuff, any kind of emotional, mental illness, literally every single thing.
Wow.
The stuff that comes up often are things that they've never told anybody before, especially around, trauma. And honestly, if I could explain it, I would, but I can't. And it even blows me away when I give, the reports have about 75 pieces of information on them.
Wow.
If not more. And
they just come, it's like a download that you get. And
I see things in my head, I feel things, I see words, and then we go over the reports together, because I don't always know what the information means. Like,
right.
Really great example. I was reading a 12-year-old girl, and I heard teeth enamel. So my humanness thought, well, her teeth must, have problems. And when I talked to her mom, she said, no, her teeth are extraordinarily good.
Oh, okay. Yeah.
So I really have to work with the person.
Yeah.
To learn more information and learn, what does that mean? Like, okay, so she has that. Like, some of it's just identification, so the person knows that I'm accurate and knows that they can trust it.
Right.
And because people are like, well, I already know that. Like, what do I need to know that for?
Right.
So sometimes it's validation, you know. But a lot of the time it's, wow, I didn't realize how me being in this marriage for so long with this person who was making me feel horrible was then impacting the fact that I can't heal. So there's a lot of that.
I see that all the time. And I see that connection between, where your spirit is disconnected from your body, and then that leads to disease. I see that all the time. I could tell you a million different stories about that for sure. So, this whole concept of intuition and medical intuition, a couple of questions. First question is, how there are people that go to medical intuitives and then show up in my practice and have a protocol for health. You're advising against that. You're saying that the information you give is typically guidance, but not necessarily take these things or do this. Is that correct? Am I understanding that correctly?
So there are, I'm a very individualized person. So each person I work with has their individual issues. Even if somebody comes to me knowing they have Lyme, every case is different, as you know.
Right.
Right. So I'm not really a fan of protocols because I think you can't do one size fits all.
Right.
It really doesn't work. So I just don't, I think that people have to trust their intuition when it comes to their health. I always tell people, this is from my guides, but I don't ever want you to substitute my intuition for yours. If this doesn't resonate with you, let's figure out what does.
Right.
So I think that healthcare and diagnosis needs to be individual.
Yeah, I agree. And that's something I've always stressed. And, one of my favorite stories is when we have new providers in our practice, we customize everyone's treatment plan. Everything's customized. And most providers today are used to clicking, boxes and checking. And then like this automatic pop-up comes up of everything you're supposed to do based on the box that you clicked. And we don't do that. It's all like kind of customized. And even though the patterns sometimes are very similar and like, you need to be on an anti-inflammatory diet. I need to be on an anti-inflammatory diet. But between those, there are tweaks. There are things you need to focus on more so than I need to focus on. Exactly. So they're always like, I don't understand. This is so inefficient. Like, why don't we have a better way of doing this? I'm like, because I want you guys to think about every person and every patient as an individual. So that's the main reason for doing that. But anyhow, so one of the things you mentioned is that everybody has the ability to have some sort of intuition or medical intuition. How do we recognize it? How do we develop it?
So I think, it starts even as a parent. So I like to use parents, for example, because, I think you have children. I'm pretty sure. Yeah,
someone just tried to come in, by the way. I love it. I was like, not now.
So, when they're very little, their cries,
right.
When they're crying because they need to be changed or because they're in pain or and you start there, when they have an ear infection, you ask yourself, do I need to go to the doctor
right.
or do I need to do this? So just as parents, we start out knowing, asking ourselves these questions, and there's not a doctor sitting next to us. So we have to use our intuition to figure out what do we do. And we discount that. And so, or we don't think of it as intuition,
right.
Right. And even with ourselves, it's like you get a stomach ache. So you think, well, do I need to eat some crackers? Is this going to go away? Or do I need to lay down? Or do I have food poisoning? So we use it all the time and we just don't really think about it that way and don't give it credence. And so, what I do and what I think really good doctors and nurses and other practitioners do is they use their
intuition. Yeah. I use it all the time, but I use it, but I don't think I know I'm using it. Is there a formal way to use it? Is there a systematic way to tap into it and to use it or no?
One of my favorite techniques, and this is what I learned when I was 16, saved my life. It's a very Jungian technique, so I didn't make it up, but it's a way of actually having a written dialogue. And you don't need a lot of time for it. You can do it in 5 minutes. You write out your feelings, a question, something like that, and direct it to your intuition. You can direct it to God if you like, if intuition's too, And so you write that down and then just sit and wait for what you hear and feel in response to what you wrote and write that down.
Oh, I love that.
Then you write back to it. Then you wait again for what you hear and feel in response to what you wrote, write that down. So you're having a written conversation.
With your intuition.
With your intuition. And the only rule I have is not to overthink it, because a lot of people are like, well, what if I'm not doing it right? Or
right.
What if
so me? I'm overthink everything.
Yeah,
think my way out of it all.
Yeah, like how do I know it's not me? How do I know?
Yeah.
I always say just go with what you get. Don't analyze too much. Sometimes your intuition will tell you something that does not seem related because it has something else to tell you. And what's lovely about what I just taught you is you can use it to talk to people from the other side who've passed. You can use it to talk to your body. I think it's very important. When I had an eating disorder, I talked to my eating disorder.
Mm-hmm.
It was the best thing that ever happened to me. And it was my friend. And it wasn't there to hurt me. It was there to transform my life and to help me separate from dysfunction and help me grow and become independent. And, it's a different way of looking at negative things or illness or something like that. So
fascinating. So the process again is when you have a question, when you have something you're trying to sort out, write it down, wait, Wait, how long? A day or?
No, immediately, really, just whatever
Okay.
comes to you.
Okay. So wait, not think,
Just
everything
allow,
but think, feel,
feel, allow it
sense,
to be there.
and see what kind of shows up,
Yep,
and then
write
write
that
that down, and then write back to it, and then continue that until you
And
get your.
yeah, and just go as long as you feel like it. Like sometimes I'll literally be in the car and grab a Starbucks napkin.
Yeah.
And, and other times I have a journal and, do it before I go to bed. And it's how it's how I talk to my guides. It's how I talk to my body.
I love that. I'm going to try it. I'm going to see if I can get online. I have a million questions for myself. I'll see if I can get them all answered. And even from
my life.
I love it. I think that's such a great little hack or tool. And for all of you out there who are listening to this episode, hopefully you caught that. That's a great way, because ultimately what we're learning and talking to experts like yourself and so many others on the show is that ultimately the power is within us, and we have to tap into that power source within us. So many of us, myself included, can get fooled or have been raised to think it's outside us or somewhere over there, or it's caught up in this person or this thing. But really, really, it's within us. And if I didn't have any lesson from last year, I think that was the lesson, that that everything is within me, and as long as I put my energy and motivation towards it, then things materialize and manifest. So if the power is within us, even trying to understand your intuition is within us. So having these conversations can again help us tap into that power. So this is yet another great empowerment tool. The book you're writing, you said, is coming out in 2021. What are you hoping to do with that book? Does it have a title yet?
The tentative title, which my publisher still likes so far, is Soul Inspired Healing.
Okay.
And it's a 7-week plan for emotional, physical, and spiritual wellness and healing. And it's using some of the actual techniques that I use and teach during my individual readings.
Okay.
So it's, my backstory as well. Also guidance from my guides. But I really want to, again, empower people to identify their issues, and then to be able to use accessible tools to not only be able to work on things on their own, but then be able to choose from just this huge sea of options that are out
right.
there. It's really can be so confusing.
Right.
But the basis is using your intuition to do all of this. That's really the core of it.
I love that, because that's one of the biggest things that I get in practice, or even when I speak, like, what is the right thing for me to do? I almost now tongue in cheek say, what's your wellness? Like, what do you like to do? But I think at the end of the day, it is trying to individualize it and fashion it towards you and creating your life and your fingerprint, your footprint, so to speak, to bring you to your fullest potential and help you, realize whatever it is you want to realize in the world. So I think this is such a great, an additional great tool that everybody out there can use. If you had one last thing that you wanted to leave the audience with, what would you tell them?
That's so funny. You just read my mind.
Oh, I'm good at this. I'm learning. I just read your mind.
I swear to God, you did. Honestly, it's that what I learned through my healing when I was 16 is still true today. And it's the core of my book. And it's with connection to intuition and self-love and self-acceptance, you can heal from anything.
I love that. Self-love and self-acceptance. So that's our mission, guys. That's what we really want to stay focused on. Katie, thank you so much for joining me today. If folks want to get a hold of you, they want maybe a reading from you, or they just want to connect with you, what's the best way for them to do that?
My website. I'm on Instagram and Facebook as well.
I see you on Instagram.
Yes. It's called Katie Beecher Medical Intuitive. But my website is Katie Beecher, KatieBeecher.com.
Awesome. That's easy enough. And for everybody else, thank you for joining us on this episode of Superwoman Wellness, which, remember, it's now on Spotify as well. You can rate and review it and share it with your friends. And I will see you guys next time.
Thank you so much.
Thank you, Katie.